April is Congenital Diaphragmatic Hernia Awareness Month. That's a mouthful, and it's a lot to talk about this morning. CDH occurs in 1 in 2,500 births in the United States every year, and that's where the Sensigreen CDH Foundation comes in. They help patients and families dealing with this life-altering diagnosis. I'm sure you're like me and you want to know more about this. We have the director from Sensigreen here, Amy Wadsworth Register, to tell us more about it. Thank you so much for being here.
Thank you so much for having me.
Okay, like I said, that's a mouthful, and not everybody, unless they've had to deal with this directly or even indirectly, knows about this. So tell us about this diagnosis.
CDH, congenital diaphragmatic hernia, occurs in 1 in 2,500 births, like you said, annually in the United States. That's a similar prevalence to cystic fibrosis and spina bifida. However, unless families have been affected with this diagnosis, very few have ever heard of it. So the Sensigreen CDH Foundation started last year. We are working to connect with every Alabama family that is diagnosed with CDH. Then we do medical grants and we do other support initiatives to help them get through their stay in the NICU and get them on the right path to getting these kids healthy and living the fullest life possible.
Well, this is about raising awareness, so
yes.
Tell us about this diagnosis. What is this situation?
What happens when congenital diaphragmatic hernia is diagnosed? Generally, it happens in utero at a 20-week anatomy scan ultrasound. The diaphragm, which separates your chest cavity from your digestive organs, either does not develop at all, develops incompletely, or develops a hole in it, and it allows your digestive organs to move into the chest cavity and restricts lung growth. Many of these children are born with as little as 25% lung capacity. When that happens, it can lead to a lifetime of asthma and those sorts of things. Many children end up having repair surgery in the first week to 2 of life. That gets them on the road to being healed, but it's still a lifelong diagnosis with many repercussions.
Well, I hate to even think about surgery as an adult, but on a little bitty baby, I cannot imagine what that must be like for the parents just having the baby and for the doctors to have to operate on such a tiny, tiny patient. We're showing a little diagram here of what it kind of looks like, and some of the kids who have been affected by this, they are probably here in Alabama feel like nobody even knows who they are and nobody's there for them because you're so new, your foundation is.
We are very new. We have had the opportunity since December to give grants to 2 families, the Kitchens family in Dothan and the Jones family in Mobile. Carter Kitchens in Dothan is close to 10 months old. He had a very severe case. He is doing very well, but they have to be aware of things like he can't go to daycare because of RSV, the common cold, flu. So they have to be very careful of where they take him out, even though he's doing extraordinarily well. Our little Harrison, he has connections here in Montgomery. He is in NICU right now in St. Petersburg, Florida, with a world-renowned CDH surgeon. His family is from the Mobile area, but his aunt and uncle live right here in Montgomery. He has done beautifully. He was born on March 19th. He had surgery the following week. He came off of ECMO, which is the heart-lung bypass machine that allows the organs to rest while it does the work to oxygenate and pump blood for the babies. 2 days ago, he was extubated. He's back on CPAP and doing very well. I actually talked to his mother on the way to the station this morning.
Well, you said, that's fantastic. You said that you help these families, but that takes funds. So
it does.
How do you do that? How do you get that?
We have lots of ways that people can give. Currently, we have a no-show Mother's Day ticket sales going on right now. That's through the end of this month. Anyone who goes on our website and buys one of our no-show tickets for an event that we are not going to see you at, you register to win, for every $50 donation, a luxury handbag of the donor's choice. We will draw for that on May 11th in honor of our moms, just before Mother's Day. We also have a golf tournament happening at Moore's Mill Club in Auburn, Alabama on April 23rd. It's our inaugural golf classic. We're also having a silent auction and a Mother's Day market. So even if you don't golf, come out to Moores Mill between 10 and 2 on Monday the 23rd and buy some of the fun things that our Mother's Day market vendors are going to have for your mom or for your wife or for yourself.
Yeah.
And then also bid on some of our silent auction items, which are amazing. There's several that are in my guest room right now that I want to keep, but I can't. So, and then if you are interested in golfing, we can take teams up through the end of the day, Monday the 16th.
Okay, if they want to find out more about your organization, how do they do that?
On sensigreen.com, www.sensigreen.com/CDH.
Thank you so much for being here.
Thank you.
Good to see you. Keep up the good work.
Thank
okay?
you.